So we're going to be quite practical and just talk about some basic concepts of fertility and infertility and what to expect if you need to see a fertility specialist and things like that.
Yeah, so the definition of infertility is trying to conceive for a year with no pregnancy. Infertility is really prevalent in Canada and affects about 1 in 6 couples.
As for the causes of infertility, it's a fairly even split between male factor, female factor, and then mixed causes or unexplained causes.
So ovulatory dysfunction is one of the most prevalent causes of infertility in Canada. Ovulatory dysfunction means that an egg is not being released by the ovaries every month. So typically this should happen every 28 days or so and allows the egg to be fertilized by sperm. So ovulatory dysfunction means that there's no egg that's being released or the egg is being released irregularly. If your cycles are more than 45 days or less than 25 days, that could be a sign that the ovulation is not occurring regularly or normally. And the most common cause of ovulatory dysfunction is PCOS, or polycystic ovarian syndrome.
Other causes include male factor infertility, and that could be low numbers of sperms, in some cases no sperm at all, poorly swimming sperm, and sometimes abnormal shape of the sperm as well. And then there's also tubal factor infertility, which is where typically both tubes are blocked. That really creates such a difficult problem for egg and sperm to meet, and that can be caused by a past history of infection, by a ruptured appendix, by endometriosis, which Dr. Francis briefly mentioned. So a lot of these potential issues go hand in hand with some of the basic kind of menstrual cycle concepts and diseases that we see sometimes in women.
Unexplained infertility affects about 20% of the patients that we see. So unexplained infertility means there is an egg that's being ovulated every month, there's more than enough sperm for fertilization to be possible, and there's at least one fallopian tube open, but still no pregnancy is occurring. This is a very frustrating diagnosis for patients, and even though if we're never able to provide a diagnosis, we work together to try to help boost the chance of pregnancy every month through various different options for fertility treatment.
So these are some reasons why you may want to visit a fertility specialist. So in women under age 35, if you've been trying to conceive with regular cycles for a year, if you're over 35, we recommend starting to see us if it's been 6 months. If you're having issues being able to even have intercourse at all because it's too painful, or because of erectile dysfunction, or because of other factors related to that, that would be another reason. If the periods are irregular, then you should really start to see a fertility specialist sooner. So as Dr. Kanji mentioned, usually up to 35-day cycles. If they're typically much longer than that, that would be a reason to see a fertility specialist and might be an indication that there isn't a regular ovulation. And then for people who would like to build their families with either donor sperm, donor egg, or using a gestational carrier, those are also things that we are well equipped and very happy to help you with. And we even have a whole team that works just with donor and surrogacy to help provide education and connect patients with the appropriate resources to pursue those options. Recurrent pregnancy loss would be another issue, and that's typically defined as at least 2 miscarriages, but some definitions will refer to more like 3 miscarriages, but either way 2 or 3 miscarriages would be significant and something that we'd be happy to see you about. And then finally, if you're interested in fertility preservation, and I think again a testament to a lot of education that has gone on generally, we are seeing a lot more women take control of their fertility, and knowing that with much longer time that women tend to spend educating themselves, preparing themselves for their career, focusing on their career. It's pretty common that people may not be ready or at a point to start a family until they are over 35, or in some cases even beyond that. And I remember in medical school, if you trained in medicine, you're really lucky to see the chart like regularly in your med school classes showing, decreasing fertility, increased risk of miscarriage, and essentially the decreasing fertility curve goes up and starts to peak more sharply at age 35, and then increased rate of miscarriage is similar and starts to kind of go up more sharply once women are over 35. So I think for some of us who had that information because we did medical training, that was helpful, and certainly that, is front of mind when you're still pursuing your training. But I'm happy to see that I think information is becoming more broadly available for women who may want to do that. And it's actually quite an easy process, which I think we're going to talk a bit about that at the end. Mm-hmm. Yeah.
It's not scary to come see us, even if it's just to ask us some questions about your fertility or preserving your fertility. Generally, we'll take your history, and then after that first visit, you can do some tests if you wish. The vast majority of the tests that are ordered by a fertility clinic are OHIP covered. So the tests that we recommend for patients presenting with infertility would be a sperm test, hormonal blood work, and 2 ultrasounds for the female patient. So the ultrasounds, one would be an antral follicle count. That would give us a sense of what your egg count looks like now. And the second ultrasound is a saline sonohysterogram. So that's an ultrasound where a small amount of saline is placed into the uterus, and then an ultrasound is performed so that we can see the saline flow through your fallopian tubes. All of these tests can now be done locally in Durham Region. The vast majority are OHIP covered. All can be OHIP covered if you were just looking at the basic set of tests, and usually takes not too much time at all. We'll also provide informational material on any kind of treatment that you might be interested in, whether it's egg freezing or building your family with eggs, or with donor eggs or donor sperm. And we also can have a lot of good connections where we can connect patients without any charge to them with a donor coordinator, a surrogacy coordinator, a genetics counselor, or other healthcare professionals that might be of service to them.
So just to briefly talk about optimizing natural fertility, if you are trying to get pregnant, certainly I'll maybe skip to the lifestyle part first. I think lifestyle is a huge factor, both for the person providing the sperm and the person providing the egg. So avoiding smoking, avoiding excessive alcohol, avoiding recreational drug use, getting regular exercise, having ways to manage stress, trying to get regular and a healthy amount of sleep. All of these things play a huge role in contributing to the health of egg and sperm. So I think that is something really not to be downplayed. In terms of like how to best time intercourse, as we mentioned, a typical menstrual cycle is about 28 days. Typically, as Dr. Francis was referring to, there's 2 phases of the menstrual cycle, follicular phase and the luteal phase. And if you know you have a regular cycle, without really doing any fancy tracking or testing, you can kind of just back count 14 days. So if your cycles are 28 days, approximately day 14 is probably when you're ovulating. If your cycles are 30 days, then approximately day 16 would be roughly when you're ovulating. And it's around that time that you want to have intercourse. And lots of people have lots of questions about how much intercourse to have. Is it too much? Is it too often? I mean, ultimately, if the sperm is going to the place that we want it to go to, too much is not an issue. But sometimes when people have been trying for a long time, it can become tiresome in that way. And so the best days would be the day just prior to ovulation and the day of ovulation. And that can also easily be tracked with just urine ovulation test strips, which are easy to find for quite affordable time or quite affordable prices. And then things to avoid, really, that just goes with a lot of the lifestyle factors that I mentioned.
Okay, so we just wanted to also briefly mention egg freezing. So egg freezing is a way to help preserve fertility, but it's not a guarantee. So I generally tell patients that the best time to start trying to conceiving is as soon as you're ready, but if now's not the right time, egg freezing is an option for some patients. Egg freezing on average in Ontario costs around $8,000. One misconception is that egg freezing takes an extremely long period of time to do, or it's a really big commitment. It's 2 weeks, 2 weeks of daily hormone injections. During that time period, most people continue to live their daily lives. They go to work, they do everything that they normally do. The only day that you have to miss off work is the one day that you come in for the egg retrieval, because that's the day you'll be sedated, having your procedure, and we don't want you making any important business or life decisions at that point. Besides that actual day, it's usually like a minimal impact in terms of time. The important thing to know about egg freezing is that only about 15% of people who have frozen their eggs in the past have actually come to use those eggs. And it's really because egg freezing is usually someone's plan B or plan C. But still, when we look at regret and egg freezing, no one has regret from doing the egg freezing, but when we see patients presenting with infertility at an older age, they sometimes feel regret that they didn't do egg freezing. So if you want to learn if this is right for you or if it's an option for you, the ideal age to do egg freezing is under 35 years old, because that's when your egg quality is the best. But there's no bad time to come and meet with Dr. Campbell and I and have a discussion about it and see if it's right for you. I notice we're out of time, but I just wanted to say one other thing, that we were very honored to be invited to speak here today, because we're really passionate about bringing good health care to Durham Region. I live here, we work here, and I brought my kids, Adam and Noah. They're over there too. Okay. Hi. Okay. Thank you very much.
Thank you.